Good afternoon, all. Thank you for joining today's conversation, Taking Care of Yourself, Self-Care Strategies for Effective Leadership During COVID-19, partnership between the National League of Cities and the American Psychological Association. Just flagging, this town hall will be recorded. If you have any questions for our panelists, please enter them in the question box during the presentation. And without further ado, I'd like to turn it over to our moderator, Mayor Lindsay Horvath of West Hollywood, California.
Thank you so much, and thank you to everyone who has logged in and is participating with us in this new virtual world. While we all represent our own communities and cities, we're all one today in this virtual time, and I want to thank you for making some time for yourself and to have this conversation, which is really important to keep us motivated and committed to the work that we're doing each and every day for our cities. I'm not just a mayor, as many of you know in your own lives. In addition to your elected service, you're also a family member, a friend. You might have a full-time job. You have a lot of commitments and responsibilities that you've signed up for and are part of your everyday life, and figuring out how we manage that in this time of crisis while we're also managing everything that we're doing for our own communities can be a lot. And so taking this time to have this conversation is really important. And I'm here today, not only as mayor of my city, but also NLC's Human Development Committee Chair. That committee is responsible for leading NLC's federal agenda on many issues, including that of mental health. And we know that in our cities, towns, and villages, addressing mental health addressing the issue of mental health that's present in so many of our issues we confront daily, from homelessness to substance use to PTSD to gun violence, and quite frankly, the issues that we've been seeing in the headlines most recently that have been impacting our communities, while hurt and pain are being felt in Minneapolis and in many cities. We know that pain reverberates throughout our country and in our communities, and we're all taking stock of that right now. And as communities continue to face local impacts of this global pandemic we're also facing, mental health continues to be top of mind, not only for our residents, but also for ourselves as we face this new world and new reality. So once again, I want to thank you for joining us in this important conversation centered on how we as local elected officials can take care of ourselves during these challenging times. And I know that for myself, I get asked, how do you balance all of these different things that you're supposed to do every day? And the answer I give probably isn't terribly satisfying. I don't think there is such a thing as balance. We just make choices each and every day about where we prioritize our time. And we have to be there 100% for our families. We have to be there 100% for our residents. We have to be there 100% for the businesses in our communities. And we have to be there 100% for ourselves, because if we're not taking care of ourselves, we can't take care of anybody else. And so making sure that we're making time for all of those priorities that we have in our lives isn't a thing of balance so much as it is making choices and then sticking to those choices, so that way we can address all of those things that are important to us in our lives. And we know that local leaders are truly on the front lines of the response, but we'll also be on the front lines of the economic recovery, and we'll also do everything that we can to take care of ourselves so that we can take care of our communities. And so thank you once again for joining us. And now I'm going to turn it over to our wonderful Executive Director and CEO of NLC, Clarence Anthony.
Thank you very much, Mayor Horvath. And Lindsay, I really appreciate your leadership at the National League of Cities and being recognized nationally about how you are leading America's cities, especially in the area of women and empowering women to be involved in municipal government. This conversation that we're having today started by two college roommates checking on each other. And during this pandemic, and making that call and saying, how are you doing? How's your family doing? And from there, we started talking about how our members are doing. And from there, it went into this conversation about municipal officials being on the front line. Municipal officials being seen as the helpers, the people that are there for them while they're going through this pandemic. And then we went on to share some stories about the mayor of Atlanta, Georgia, who decided that it wasn't time to reopen. And then her daughter receiving a racist text. And how does she respond to that? A mayor in Oklahoma City, Oklahoma, the state of Oklahoma, Tulsa, making a decision to close down businesses and getting calls and texts about him being Hitler. And how did he deal with that? And how should he deal with that? And Dr. Evans from there said that, we really need to have a conversation about elected officials being human too. And the notion that this face that we put on as the most trusted level of government is sometimes very difficult, and that we need to be able to first take care of ourselves, and again, recognize that we are human too. And it took me back to the days when I was a mayor in Florida and going through hurricane after hurricane and being out there on the front line, passing out water, being able to give out food to the community, and then recognizing that I had not even taken care of my own family first. And so this whole conversation today is about asking you to take care of yourself first and asking for some advice from Dr. Evans with his experience of being an executive with the American Psychological Association. I also start thinking about the fact that, you being on the front lines and the notion that we had in 7 years with the Vietnam War, 58,000 troops that were killed. And within 3 months, we've had 100,000 people die from the pandemic. And it hurts my heart to even say that. But it hurts me more that you all are the ones that have to continue to lead our communities through this type of pandemic and not have the support that you need. And also recognizing that the constituents, they're not looking to Washington. They're not looking to your state capital in Sacramento, Mayor Horvath. They're looking at you in West Hollywood and saying, why can't you get this thing done? And why can't you deliver the services? I don't care that, your revenues are going down and your taxes and expenses are going up. We need you to step up and be on the front line. I'm going to reiterate this as much as possible today. You are human too. And I want to find ways to give you the support through this partnership with Dr. Evans to tell you that this is not unusual in leadership. And actually, I know Dr. Evans is going to speak to this in more depth, but something stuck out to me from APA's Stress in America's report. And it said 70% of adults, compared with 46% in APA's 2019 Stress America poll, felt significant stress about the economy. And you look at what we are dealing with right now, that stress has to be even more significant now as we look at the pandemic. And it's more amplified in local officials because you got to think about the community security, but what about your financial security? What about your own family? What about you trying to save the entire community as you try to, again, balance that life that Mayor Horvath talked about? So with that, I do want to spend more time responding to questions. because there are other things that I'd like to talk about. But one thing I would like to note, and I want to make sure we get into a little bit more, it is even significantly more stressful on people of color during this time. And I think that having to give some sense of conversation about that, because the rate of, compared to the population, the rate of people of color with this pandemic and virus is about 20% higher. And there are a lot of reasons why, but I think that that challenges elected officials as well. How do you deal with that? How do you recover while dealing with those issues? So with that, I want to take the opportunity to hand it over to my college roommate, my friend and family member, but more importantly for today, the CEO of APA, Dr. Arthur Evans. Hey, Ace, how are you?
Good. How are you, sir, Mr. Mayor? Good to be with you again. First of all, thank you all, Clarence, Mayor Horvath, for doing this. And NLC, our staffs worked really hard to pull this series together, and we're delighted at the American Psychological Association to be partnering with NLC on this issue. So this whole series is really about how mayors and city leaders can address the mental health needs of their communities. We're starting with the leaders themselves, but we're going to be talking about in future sessions, talking about the role of city leaders in helping their communities and helping their staffs. But we're starting with leaders. And just as a way of giving a little background on myself, I spent 20 years in government, many years in state government, and then 12 years in city government in Philadelphia, and state government in Connecticut. And so I have a real good sense of what those of you who are on the call who work in city government are dealing with right now. I was in state government at 9/11, and I spent days in the Armory in Connecticut, with the screens on the walls and all of the information, all the people in government trying to coordinate our state's response to that event. That early experience of what it's like to be in government and the weight that you feel as an individual in government, a leader in government, and responding to crises that your constituencies are dealing with is something that I understand. And in my work in the city of Philadelphia for over a decade, working for 3 mayors as a political appointee, I know what happens when you have these kinds of crises in cities. On a regular day, many of you are called in the middle of the night to respond to whatever crisis is happening in the city. Issues happen where you have to, you may be trying to be strategic in doing your work, and some issue comes up and you just have to respond. And that's just a part of being a city leader or a government leader. And this current crisis actually creates some additional and new kinds of stressors for those of you who are in government. And we want to take some time to talk about what you can do to manage through that. The premise of all of this is that you have to put on your mask first before you can really help someone else. That's a reference to what happens when you get on a plane. They always say, if you have a child, get your mask on first before you try to help the child, because if you go out, you have 2 people who are going to be in trouble. And one thing I know about people who work in government is, in my view, and at least my experience has been, those are some of the most selfless people that I've worked with. People are really dedicated to their communities, to doing their work. And the natural tendency when these kinds of things happen is to lean in and to do more. And it's actually counterintuitive for many of us who have worked in government to lean back and to pause. And the premise of what we're going to talk about today is how critical it is for you to lean back at some points, because if you don't lean back, you're not going to be an effective leader. And so I want to just talk a little bit about some of the stressors, just so that we can start to think about what are those things that are impacting on your ability to do your job effectively. Ordinarily, in government, you are responding to a lot of different constituencies. You may be dealing with controversial issues. You may not have the resources that you need to respond to issues that you're seeing. There's just this myriad of issues that you're dealing with naturally. The COVID crisis has added more issues that we have to deal with, and some unique things that we've never had to deal with, even if you've been in government for a very long time. Most crises that you're dealing with have a defined period of time, and most of the time we spend most of our time in a recovery phase. So if it's a hurricane, the hurricane comes, and then we're responding. We know what the course of that is going to look like. If it's a tragic shooting in your community, you know what the aftermath is going to be like. If it's a train accident in your community, you know what the course, the general course of that's going to look like in terms of how you're going to respond. We're in a situation where we don't know when the end is going to happen. We don't know what the arc of this is going to be. We don't even know when it's going to get worse. We know that we're in it now. And that level of certainty adds a certain level of stress to this work that we typically don't have when we're trying to respond. And one of the things that I've been acutely aware of, because I'm leading a different type of organization now, but one of the things I've been acutely aware of is how insidious the stressors are in this kind of situation. Because it's not always apparent that this level of uncertainty that we're living with and we're having to deal with, how that adds to the complexity of our work and how it adds to the stress of trying to do this work. And so I want to talk about a few things that we can think about and add to your way of working that will give you perhaps that pause, that ability to lean back a little bit, to do some things that are going to make sure that you're going to be an effective leader. The first is to really understand that you are in a very unique situation, and that even if your natural tendency is to increase your work in these situations, it's really important to recognize that this isn't a typical situation, and that you have to be aware of the stressors that you're experiencing. It's also important to know what your own personal stresses are. As I've gotten older, I have started to recognize more and more when the stressors, when I'm stressed. And all of us, as we age, we start to understand those things that are a tip-off that I'm under a stress. It may be, you start to forget things, or it could be that you are in more really intense conversations. Whatever those things are, to be cognizant of that and to see those as important warning signs for you in your work. It's also important to be able to pause. One of the things that happens when we're in positions of leadership, we feel like we have to solve everything and we have to solve it immediately. And sometimes we create unrealistic or unneeded timelines for ourselves. And sometimes we have more control over when we have to, for example, go out and do a press briefing or those kinds of things than we give ourselves credit for. And so taking time, taking more control over your schedule can be a really important strategy for mitigating the kind of stress. Taking time to take care of yourself physically. One of the things we know is that one of the things that helps our mental health the most is our physical activity, our ability to take care of ourselves. Now, I have to tell you that there are times when psychologists and folks like myself give advice that can often be difficult for ourselves. So I know that there are some people out there who know me personally who are saying, this might be something you might want to take a little more time for yourself. So that notwithstanding, the advice is still the same, and that is, it is really important to exercise, to eat right, to get sleep, because those things are going to definitely impact on your mental health and your ability to do your job. Probably one of the most important things, and we know this from a lot of research, is one of the most important resources that we have is our social support. And in this time of social distancing, you may have a job, even though you're in city government, where you are working from home. And one of the most important things for all of us is to make sure that we are keeping our social connections. In fact, one of the things that we've started to do, and I've started to do, is to not talk so much about social distancing, but talk about physical distancing, because social distancing is actually bad for our health. We know that from a lot of research that shows what happens when people are socially isolated. So during this time, it's really important to reach out, to make sure that we're making those connections, to make sure that we are fulfilling those relationships and doing things that will actually help keep those connections that help to sustain us. And finally, it's really important for us as we go through this to make sure that we're doing all the things that we can to help not only support our communities, but to also support our families. Clarence talked about the, I've heard him talk about a situation where he was out working as mayor, trying to help his community, and then he got a call from his wife who needed something. And the added stress that happens when you're so focused on trying to protect your constituency, and meanwhile you still have your family to take care of. And finding that right balance can be extremely important, and making time and making sure that you're doing that can go a long way in helping you to manage through this. So with that, I'm going to stop, and I think we want to spend the bulk of the time just answering your questions.
Thank you so much, Dr. Evans, and thank you, Clarence, for your words as well. And I'm so glad that you said that about languaging of social distancing, because I know we're hearing that term a lot, but it's not exactly what we mean. We want people to stay connected while they're staying physically distant from each other to keep each other safe. And sometimes our language trips us up. And so I really appreciate you calling that out. But I do know that both of you are former city leaders, as you've mentioned, and you have firsthand experience with the challenges so many of my colleagues and I are facing around the country. And, as leaders, we grapple and struggle with the enormity of the needs of our cities, that our residents bring to us, that our small businesses bring to us, everything that we've been talking about. And so what advice would you offer in terms of the importance of self-care in managing stress, trauma, health impacts, and some of those real world challenges as they face us as people, as you said, during COVID-19?
Well, I think it's really critical, and like I said, it's something that I have to work on. I'm a CEO, and I have a large staff, and we were trying to respond to the nation's needs around psychological knowledge that can help mayors and the public through this. And so, but I think that there are a lot of things that we can do, and it doesn't have to be a lot of a lot of things that are going to take a lot of time necessarily. Yesterday, I live in a apartment, 6th floor. I've been in this apartment for literally 2 months, not really going out as much, doing all of my work here. And yesterday, I just went out on my balcony and did one of my webinars from my balcony. I got sun, I had dinner out there. That made a big difference in how I was feeling. And I think taking those small breaks can go a long way in helping us to get through this. And so I think just being intentional, thinking about that, one of the things that we've started to note now is that even though a lot of us are trying to connect through social media or through Zoom or those kinds of things, we have to also be conscious of the quality of the interaction. So simply because you had a Zoom call doesn't necessarily mean you connected to the person on the other end. And so you have to ask yourself, well, what would make this a more fulfilling and more connected kind of experience? And then make sure we can do those kinds of things. I've had some recent conversations with some friends, and one of the things we didn't have a timeline, and we just spent time just talking about a whole range of things, not necessarily getting business done, but just really reconnecting. And so thinking about how you make that connection as opposed to simply having a conversation, I think is something that's really important.
Yeah, Mayor, I first of all, I've learned from what Dr. Evans shared to pause a little bit. And as he indicated, we're very similar. We're driven, and we share these things, and hopefully we hear it for ourselves. I agree. The first thing I'd give advice on is that for municipal officials and their staff, we're not Superwoman and we're not Superman. We can't solve everybody's issues. And it's okay to be able to say that I don't have the answer. There's nothing I can do right now. I know that may seem foreign to us because we are trained in a way as problem solvers, but some things we can't. And the second thing is, I do think, my team talks about this mindful meditation. And I fail every time because I forget the instructions. So they tell me to go for a walk and to look at, my surroundings. Well, they didn't tell me that I should not have Frankie Beverly and Mays in my ear playing while I'm walking. And then I get instruction, you're not supposed to have music. But what it does for you, it really does allow you that time to reflect on those things that are important, to breathe, to be able to appreciate that plant that is on your street that you never saw before because you're in the fight every day. So my advice is just take a breath. Be able to be mindful of what is around you. And again, remember that you are human too, and that your family needs you, and that they need you healthy, because we can solve everybody else's issues as public officials and oftentimes lose our sense of who we are. Mayor, this can happen because we're expected to be perfect and solve everybody's problems. But just be mindful of who you are and that you're human.
Well, that's great advice. And I think I'm seeing a couple questions come in that really resonate with me, kind of dovetailing off of what you just said. How do you justify taking that time for yourself when you see all of the things going on around you? And, sometimes that can be confused with selfishness, but selfishness sometimes is really self-love. And so there's a big difference. And so can you talk about the differences between self-love, self-care, and selfishness, and how taking time to reset, how you justify doing that?
Oh, that is such a great question. And I think that's at the heart of why we thought this was an important session to do. My experience in being in government is that there are a lot of very high functioning, driven people who are in government. And particularly if you're in a leadership position, those folks, that mentality, and Clarence and I are very alike in this way, very driven. We try to be selfless, try to be servant leaders, trying to think about how we help others. And, the trap though, and I think it's important to see it as a trap. The trap is that we're human and that we have limitations and that we are in a very unique and difficult situation. And one of the reasons I spent a little time talking about sort of the difference between this COVID pandemic and what we typically deal with is because there are some big differences. When there's a hurricane, you go in and you know what the arc of that recovery is going to look like. This is not that. This is a marathon. This is not a sprint. And you have to look at it as a marathon, and you have to be in it for the long haul. And so I think all of us as leaders have to think differently about the situation that we're in. One of the conversations that I started having with my staff probably 3 weeks into this crisis was, folks, we cannot operate at this level. We will burn out. We have to switch gears and move to seeing this as a long-term situation. We have to reorganize ourselves in the organization for the long haul. And so rethinking and recalibrating the situation that we're in, I think is going to be critical for our success. But that also means that we not only need to think about that organizationally, we need to think about that in terms of ourselves. And if we're thinking we can run a sprint while everyone else is running a marathon, we are deluding ourselves. We know what happens when you're running a sprint and the people around you are running a marathon. You're not going to be at the end of that race. And so I think first getting our minds right around that is really critical. It is not selfish to, they tell you on the airplane to put on your mask first. They're saying that because if you don't do that, you're no good to anyone else. And it's really critical particularly for leaders to do that. One other thing that I'll say about this is where delegation becomes really important. And again, many leaders, their natural tendency, if you're a successful leader, you're in your position because you've been successful. You're successful because when there are these kinds of challenges, you rise to the occasion and you put more effort in. And this is a situation where rising to the occasion isn't necessarily, rising to the occasion is important, but also being smart about how you do that and delegating and making sure the job gets done doesn't necessarily mean that you have to do it.
So I agree 100% with what Arthur is saying. And I'm going to turn it around a little bit, Arthur, to ask you this. We're in a different business. We get reelected or elected based upon showing up. And if there is a big event, as tired as we are, stressed as we are, what do we do about the business that we are in? Because I can tell you the reason I was there during the hurricane, the reason the mayors are there passing out food and making sure the seniors get food. I mean, I have one council member in Houston that was out there passing out food and support, and she herself got COVID and had to go through that battle. What advice do you give us when there's this expectation and challenge that we get reelected because of our being present?
Yeah, well, I don't think there's anything wrong with that. And I don't think that there is anything wrong with leaning in and doing what you need to do. But it's also important to be able to take that time off and to carve out time, not only for your own health, but if you think about it this way, people are looking to you to get cues about how they're going to operate. And if you have your staff's best interests at heart, you need to model what you want them to do. Today, one of the things I'm doing now is regular, what we call them coffee breaks, where I'll do a Zoom call with, 60, 70 of my staff. And I started today by showing them a picture of me sitting on my balcony eating dinner yesterday. And I talked about how rejuvenating that was. And what I was trying to signal to them is, if I'm going to ask you to take care of yourself, I want to model that for you. And I think, mayors, any leaders in government, again, if their mindset is we're in this for the long haul and we need to be successful over the course of this entire thing, and I need a team to get us there, then I need to model the behaviors that I want them to exhibit in order for us to be successful.
I like that. And the other thing that Ace and I have in common is the love of music. And in our dorm room as college students, we would have music going all the time. And for me, that's my catharsis. I, with my all staff meetings, encourage music, and it shows who they are, where they came from, perhaps. And I think that identifying what provides you as a municipal leader or elected leader, that outlet, whether it's walking, jogging, whether it's music, whether it's spending time doing a puzzle. I do think that, again, you are human too. As Dr. Evans has indicated, you got to put on your face mask first, and then you can be helpful to others. But if you're not solid and you're not healthy, then you can't serve others. And I know, Lindsay, I saw Superwoman behind you. So I know you think you're a Superwoman as well, Mayor.
Well, Wonder Woman's on my wall, and
Wonder Woman. Okay.
Yeah. She's of the time, all over again. But I think what you were saying about how we model that for our residents is really resonant, and actually one of the questions that came in has to do with, we see the disparities in healthcare access. We see the differences in how people are treated and cared for. We see the differences in how COVID is impacting communities of color. So how do we authentically model being in solidarity with our communities when we know that we may sit in places of privilege compared to what our residents are experiencing? Or how do we also be honest about some of the mental health challenges or other challenges we're experiencing in our own families, while we're also trying to help deal with the challenges and crises that exist in our own communities. Sometimes, being able to model that is helpful, but sometimes that's a scary thing to do, to be that authentic, to be that, unvarnished. And then it can even open you up to potentially more criticism or critique. So how do you deal with that?
Well, I can start. I can start. Well, I think it's a really important thing, and I actually think, and actually there's psychological research that shows that one of the things that endears leaders to people is seeing their vulnerability, and I think that goes against what a lot of people believe. They think that if I'm a leader, I can't show any kind of emotion, I can't show any kind of vulnerability, but in fact, what research shows is that when we expose some of those aspects of ourselves, that it actually endears people to us. So I think people should keep that in mind. But I also think that particularly around the issue of inequities in communities, being in a leadership position, you have a bully pulpit. and whether you're a commissioner or you're the mayor or whomever, and to be able to speak out on those issues, I think goes a long way. I also think that what Mayor Anthony was talking about in terms of showing up, that makes a big difference. Like I said, I work with 3 mayors, and it was fascinating to watch how they operated. But one of the mayors who I thought was really successful in terms of how he was endeared to the community was, one of these people. He didn't have to have a crowd of 100, 200 people. He would go to these events sometimes, there'd be 30 people or 40 people, and just showing up and saying, the issues that you care about, the things that you care about are things that I care about, and they're showing their support. Those things go a long way in helping communities that are struggling or that are struggling with those kinds of disparities, those kinds of challenges. They go a long way in giving people hope that they can really overcome that. So I wouldn't underestimate how important it is to show up, to lend your voice, to make a statement on those kinds of issues that are happening in communities.
Yeah, I agree with Dr. Evans. This is another one of those frontline, tug at your heart, feel like you're responsible moment that creates stress for elected officials. You can find yourself watching the news and looking at the data reports about people of color dying in Milwaukee and Chicago, in all parts of America at a higher rate. And then you get the data in your own community and you feel like you don't know what to do with these vulnerable populations. And you come up with all the strategies and you still are challenged with coming up with some outcomes. Again, that's the part that people don't see. And that's the part we own. But I do think taking that pause that Dr. Evans talked about and taking a breath and recognizing that our role is not to 100% wear it, but we got to show up and come up with solutions to resolve it. And I think that what I'm encouraging municipal officials to do is to collect data, disaggregate that data, recognize what populations are being impacted, and then acting at some point with your team members. And your team members is not just you by yourself. I often remember a story with my mom when she was here alive, and I would go to dinner with her before every council meeting. And I went to council meeting and I'm sitting on the dais and I see her come into the room. And I'm like, wow, she didn't tell me she was coming to my city council meeting. I'm up for re-election. She gets up on the public comments and she says, members of the commission, my baby, good evening. Of course, I got embarrassed because she called me her baby. I'm the mayor, right? She complains about garbage pickup. And I looked down and I said, hey, Mom, I just had dinner with you. And she said to me, I'll never forget this. She said, you think every issue in the city is only your issue. It's all of you sitting up there that have to resolve this issue. And it's all of us in our community. So I think that what Dr. Evans and I are saying is that leaders, you can't take on all of the responsibilities on your shoulder. You can be in a position to show up, but you can not solve it by yourself. It's going to take you sharing it as mayor, Lindsay. It's going to take other mayors sharing with their council and their other community leaders. So I just think this is a great time and a moment for us to, again, go back to this. Two things, one thing Dr. Evan has repeated, and I'm going to say this a lot. You got to first put your mask on, right? But also, I'm going to repeat, we are human and we got to act human. And humans are tired sometimes. and humans need support. So that's all I got for our elected officials.
Can I add something to that, because that reminded me of something that I also think is important. And actually, this is another area where psychological research has helped us. It is so important to come across during this pandemic as an authentic leader. And one of the ways you come across as an authentic leader is to be honest with people and to share with people those things that you know, those things that you don't know, those things that you can do, those things that you can't do. What will erode people's trust from you as a leader more quickly than anything is if people think you're BSing them, you're not giving them the straight story. And during this pandemic, when it is so important to get people to behave in a certain way, because if they don't, it can have an impact on your entire community. It is really important for you to be viewed as an authentic leader. And a big part of that is just sharing with people, I don't have an answer for that. People will appreciate that much more than if you try to talk your way through things. And it will ultimately result in you having less credibility.
Yeah, I think you're absolutely right. It's certainly been my experience. People appreciate when I give it to them straight, rather than try to give it to them in some sort of polished, fancy talking points. And, but I also think too, one of the things that, now you're working literally from your home, bringing people into your home in this virtual world. We're eroding boundaries between home and work, or city hall and work, our dais and our home. And yet we're having this conversation about, it's healthy to set boundaries, it's healthy to delegate, and we're eroding them in so many ways. So how do we establish appropriate boundaries? How do you give advice in this new normal, where there seem to, a convergence of everything is happening right at maybe your own kitchen table? How do you establish boundaries and do exactly what you're saying? What tools would you advise we employ to do these things?
Well, I think this would be one of those areas where I think how we do that in this new virtual world is evolving. One of the conversations I've had with my staff is one of my observations in this new virtual world is how intentional we have to be about things. And I'll give you an example. I was noting that one of the things that happens when we're face-to-face and we have a meeting, there's this period beforehand and afterhand where you have an opportunity to have informal connections with people, to talk, to check in with people. Sometimes we do some quick problem solving and those kinds of things. And in the Zoom world, which most of us are living in these days, you have a meeting and you click leave the meeting, and then you're off and you're clicking on to the next link to go into the next meeting. And you don't have that kind of that opportunity for that kind of interaction. And so what I've said to my staff is we have to figure out in this new virtual world how we get that phenomena back into our interactions. So one of the things I was talking about was, maybe I'll do a sort of office hours, so I'll have a Zoom session and people can just pop in as a way of having that informal connection. Because sometimes people don't want to set up a meeting with you as a leader because they don't think the issue is significant enough for you to have a meeting on it, but it's important, but they don't talk to you about it because they don't have an opportunity. So if we can be intentional about creating those opportunities to compensate for those things that we lose in the virtual environment, I think it will help us. I think that also goes for boundaries. There may be new things that we will have to do in order to do that. I think some of those will evolve. I will do a self-disclosure here for a moment, just to give you a sense of how conscious I have become around boundaries. The picture that you see behind me is not the typical picture that is behind me when I meet with my staff. It's actually a different picture. And and it probably more revealing about sort of, me, my personality. But this is a different audience. And so I felt that I needed to have a different boundary around what people saw. And I changed that picture depending on who I'm talking to. So that's an example of being intentional about thinking about what are the boundaries that I need for this particular audience, and then how do I create those?
That is very interesting, and thanks for that advice. I mean, it really is helpful. Again, I'm saying something that I'm working on myself because as a CEO, Dr. Evans, as you know, it is really hard. It's partly like a public official. You got thousands of employees relying on you to make sure that things continue and to be okay. And so oftentimes I find myself available at 10 o'clock at night, and trying to schedule those boundaries is very important. So I have, and I know a few members of my team is on this webinar, but I have intentionally created false names on my schedule so that they wouldn't put themselves there. So I know you haven't done that.
I wouldn't do something like that. I wouldn't do something like that.
I know you would not. That's the difference between you and I all these years. So, but I think it's important to be able to give yourself that time and call focus time or breathing time, because otherwise it is very, very difficult to set those boundaries. And I do think that this process has led a lot of people in our homes. And that has been different for me. And wanting to change where I'm sitting in my home. And sometimes the pictures that are behind you, people are looking at them instead of you. And I think for public officials, we're used to being public, but I don't think we're used to being this public, where folks can actually see your kids running around, or your wife looking at, or I forget to put it on mute, and my wife said, "I wish you would have put that dish towel in the dishwasher."
I've had that. I have the microwave going off. I have chores that I should have done. Yeah. I think we've all had that experience.
Yeah,
Absolutely.
So I do think it's that feeling. Yeah, there's boundaries, but also, again, you're a human too. And knowing that the microwave does go off, knowing that your air condition went out like it did here in Florida, 90 degrees, that it's okay. I can't tell y'all I am that comfortable letting the 300 people that may be on this webinar, but I'm getting comfortable with that. So the boundaries have even been tougher, I think. And Mayor, you probably can speak to this as well. Probably a little bit too much sometimes for me.
Yeah, it can be a lot. And on just as you said, on the one hand, we get to know things about people that, might make us like them a little bit more, or help us develop different kinds of opinions. But sometimes when you are working so hard, not only to establish boundaries between what you keep for yourself and then what you share with the public, but also, how you're trying to convey the strength and support that people are expecting of you while you have all these things going on around you is really tough. And especially, I know a lot of folks in my community live by themselves. So if you're doing it all yourself all the time, and you're kind of in that space all the time, and you don't have anybody else helping you out in your household or keeping things clean or sharing the chores and all of that kind of stuff, it piles up. And it can start to feel like a lot if you're not escaping your space. I know that even just you know, sometimes, as you had indicated, Dr. Evans, clicking from one meeting to another, you know, in real life, we might have a commute time between meetings or something to unplug. And so, you know, while I, you know, in some ways appreciate not having that commute, sometimes it doesn't allow you to turn off. And so one of the things that we also click to is some of our social media. And one of the questions that came in was, how do we, you know, deal with social media as we're dealing with all of these things too? Sometimes it's the way we stay connected with people, but sometimes it brings in a whole new kind of toxicity to our discourse and to our engagement with folks. And so how do you have special tips on how to deal with using social media for all the reasons we like it to connect, and how to, you know, avoid the stuff that really can be a problem for us?
That's a great question. And this is another thing that we know from research, is that too much social media is generally bad for us. And we have to take it in moderation. Media in general, we have to be careful about, particularly getting a lot of news around COVID and the pandemic. You really should limit the amount of information that you're taking in that way. Probably get 2 or 3 trusted resources and focus on those. For one thing, there's a lot of misinformation out there, but the other thing is you don't want to overload. And when it comes to social media in particular, it can be very difficult, particularly for people who are in government, because a lot of things that you will see on social media are very critical or can be very critical of government. So you have to sort of manage that and to moderate it, but it really is important not to spend too much time on social media and in media in general.
Well, I know it's getting to about that time, so I want to, you know, offer you the opportunity to share any last thoughts, things that you want to leave us with before we go out into the world to practice everything that we've learned in this discussion today, to be very Zen as we continue the rest of our week and our work in this really difficult time.
Well, I'll give the mayor the last word. So I would say, you know, I hope that if you got nothing from this other than the idea that it is important for you to put on your mask first, and that you can take a pause, and that it's really important for you to take care of yourself if you're going to be an effective leader. And just think about, just do one thing today, just one thing that gives you pleasure, one thing that gives you a little bit of rest, and see how it goes, see how you feel. And then maybe you try another thing tomorrow. This is learned behavior. You can learn how to do this in the same way that you learn to be the great leader that you are in government. You can also learn how to take breaks and to run this marathon that we find ourselves, in which we find ourselves.
Yeah, I'll just end with this. I learned a lot from Dr. Evans as well as the mayor. I do think being able to be vulnerable and saying I'm tired and that I need a break, that I'm struggling with this, so that your citizens do see that human side of you, that you care, and that you need to go home and take care of your family because you haven't talked to them in a day and a half because you've been doing these things. You know, putting on that cape that we put on don't allow us sometimes to create those boundaries that Dr. Evans talked about. So as we started, you're human too. Find some time to be selfish for yourself, because if you're not healthy and mentally healthy, you're not going to be the leader that you could be for your community. So this conversation that we've had today, probably for Arthur and I, started in 1979, when we were in college. And these are the kinds of conversations we would have about how we want to make sure that our lives are there, and we set goals. I mean, goal after goal after goal, and we achieved a lot of them. But I hope that you will join us on June the 4th, our next conversation, because we're going to be as candid as we are today, and we're just going to talk about our feelings and how it can help others. That's our goal. Thank you, Mayor. Appreciate it, Dr. Evans.
Thank you. Thank you
you,
both
Mayor.
for this
Thank
great
you both, mayors.
conversation.
Yes.
Yeah. See
Thank
y'all
you.
later. Thanks to our staff. Good job.
Yeah, great job.
All right. Take care. Thank you.
Thank you, Mayor.
Bye, Lindsay.
Bye.